Borderline personality disorder, BPD, in-depth overview. 1. Definition and key characteristics. BPD is a clinically recognized mental health disorder characterized by pervasive patterns of emotional dysregulation, impulsivity, unstable relationships, and a distorted self-image. This disorder is listed in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, which sets out the official criteria for diagnosing BPD. Key features of BPD include: 1. Emotional instability. Individuals with BPD experience rapid mood swings that are often extreme. 1. These mood shifts can last from a few hours to a day and are often triggered by interpersonal stress or perceived rejection. 2. Fear of abandonment. A hallmark symptom of BPD is intense fear of abandonment. 2. This can manifest as extreme efforts to avoid abandonment, whether real or imagined. 2. In some cases, people may go to great lengths to prevent real or perceived abandonment, such as clinging to relationships or engaging in impulsive behaviors, for example, drastic changes in behavior, self-harm. 3. Unstable relationships. Individuals with BPD often experience relationships as extreme, alternating between idealizing and devaluing others. 3. They may see someone as perfect one moment and then feel betrayed or rejected the next, even over minor conflicts or misunderstandings. 4. Unclear or distorted self-image. A person with BPD may have a fluctuating sense of self and often experience confusion about who they are. 4. This unstable self-image can affect their goals, values, and relationships. 5. Impulsivity and risk-taking. People with BPD may engage in impulsive behaviors that are self-damaging, such as reckless driving, substance abuse, unsafe sexual behavior, or binge eating. 5. These behaviors are often a way to cope with overwhelming emotions. 6. Chronic feelings of emptiness. Many people with BPD report feeling a persistent sense of emptiness or a void that they cannot fill, leading to dissatisfaction with life and a yearning for external validation. 7. Inappropriate anger and difficulty controlling emotions. Intense feelings of anger can lead to outbursts, and people with BPD may have difficulty controlling their emotions in the face of frustration. 7. This often manifests as verbal outbursts, or aggressive actions. 8. Stress-related paranoia or dissociation. Under stress, individuals with BPD may experience paranoid thoughts, where they feel like others are conspiring against them or being intentionally hurtful. 8. They may also experience dissociation, feeling detached from their body or surroundings as a way of coping with emotional pain. 2. Causes of BPD. The causes of BPD are believed to be a combination of genetic, environmental, and neurobiological factors. 1. Genetic factors. Research suggests that there is a genetic predisposition to BPD, particularly in families where members have personality disorders, mood disorders, or other mental health conditions. 2. Environmental factors. Childhood trauma, particularly experiences of emotional, physical, or sexual abuse, neglect, or abandonment, are common factors in the development of BPD. 2. A history of inconsistent caregiving, emotional invalidation, or invalidating family environments can disrupt the development of secure attachment and emotional regulation. 3. Neurobiological factors. Abnormalities in brain regions involved in emotion regulation, such as the amygdala and prefrontal cortex, may contribute to the impulsivity and emotional instability seen in BPD. 3. Neurochemical imbalances, for example, serotonin dysregulation, can also play a role in mood and behavior. 3. Treatment of BPD. BPD is a chronic condition that can significantly impair one's functioning and quality of life, but effective treatments are available. The main forms of treatment include: 1. Dialectical behavior therapy, DBT. DBT is the most widely studied and effective form of therapy for BPD. 1. Developed by Dr. Marcia Linehan, DBT helps individuals with BPD learn to tolerate distress, regulate emotions, improve interpersonal effectiveness, and develop mindfulness skills. 1. DBT combines cognitive behavioral techniques with mindfulness and acceptance strategies. 2. Cognitive behavioral therapy, CBT. CBT is another therapy that is effective in helping people with BPD challenge and reframe negative thought patterns and behaviors that contribute to emotional instability. 3. Mentalization-based therapy, MBT. MBT helps individuals with BPD understand and interpret their own and others' emotions, thoughts, and behaviors. 3. It focuses on improving interpersonal relationships and reducing impulsivity. 4. Medication. While there is no medication specifically for BPD, medications such as antidepressants, mood stabilizers, and antipsychotics may be used to help manage symptoms such as anxiety, depression, or impulsivity. 5. Group therapy and support networks. Group therapy and support groups for BPD can provide individuals with a sense of community, shared experiences, and emotional support. Reactive borderline traits. In-depth overview. 1. Definition of reactive borderline traits. Reactive borderline traits are emotional patterns or behaviors that mimic those of BPD but tend to arise as a response to acute stress, trauma, or situational factors. Unlike BPD, these traits do not necessarily persist over time and are more transient in nature. For example, someone might exhibit intense emotional reactivity, impulsive behaviors, or fear of abandonment in response to a significant life stressor, such as a relationship breakup or the loss of a loved one. However, once the situation is resolved or the person learns to cope with it, these traits may diminish or disappear. 2. Key characteristics of reactive borderline traits. 1. Emotional reactivity. People with reactive borderline traits may experience heightened emotional responses to stressful events, but unlike BPD, these emotional swings are usually short-term and specific to the stressor. 1. The emotional reactivity often reflects an acute reaction to overwhelming or triggering situations rather than a chronic pattern of instability. 2. Fear of abandonment. Individuals with reactive traits might show fear of abandonment or rejection when facing relational conflict or separation. 2. However, this fear is often related to specific circumstances and may not persist once the external trigger, for example, relationship resolution, is addressed. 3. Self-image and identity confusion. While identity confusion is a key component of BPD, people with reactive traits may not experience a chronic lack of self-concept. 3. They may struggle with self-image, but it often improves as the stressor or trauma resolves. 4. Impulsivity. While impulsive behavior can appear in people with reactive traits, for example, acting out, engaging in risky behavior, it is usually situational and does not reflect the ongoing pattern seen in BPD. 5. Relationship instability. In cases of reactive traits, relationships may feel unstable due to specific incidents or stressors, but they generally do not follow the extreme patterns of idealization and devaluation that are characteristic of BPD. 3. Causes of reactive borderline traits. The key difference between reactive borderline traits and BPD is the trigger. The traits typically arise in response to a specific life event such as 1. Traumatic experiences, for example, loss of a loved one, sudden breakups, emotional abuse. 2. Chronic stress in a particular area of life, for example, work or school-related pressure. 3. Relationship conflicts that are intense but temporary. In contrast to BPD, these traits are often temporary and transitory. 4. Treatment for reactive borderline traits. Since reactive borderline traits arise from specific stressors or traumatic events, the treatment tends to focus on 1. Coping skills, helping the individual learn healthy ways to manage stress and emotional turmoil. 2. Supportive therapy. Brief interventions like CBT or solution-focused therapy can be helpful in addressing the specific issue that triggered the traits. 3. Trauma-informed therapy. If the traits were triggered by trauma, a trauma-focused approach, for example, EMDR, may be useful. 4. Relationship counseling. If the issue involves relationship conflict, couples therapy or family therapy might be indicated. The focus here is on managing the acute issue and improving emotional regulation during times of stress. Key differences between BPD and reactive borderline traits. 1. Duration. BPD involves long-standing emotional instability and interpersonal difficulties, while reactive borderline traits are more short-term and directly related to specific life events or stressors. 2. Pattern and consistency. BPD is characterized by consistent, pervasive patterns of emotional reactivity, fear of abandonment, and relationship instability across many areas of life. 2. In contrast, reactive traits are situational and may subside once the triggering event is resolved. 3. Self-image. Individuals with BPD often have a chronic, unstable sense of self, whereas those with reactive traits may experience temporary identity confusion but generally have a more stable sense of self over time. 4. Treatment approach. BPD requires long-term therapy, particularly DBT, to address chronic emotional dysregulation and interpersonal difficulties. 4. Reactive borderline traits can often be addressed through short-term interventions that focus on managing stress and addressing the specific life event or trauma that triggered the emotional reaction. Conclusion: while BPD is a clinical, long-term disorder that affects many aspects of a person's life, reactive borderline traits are more temporary and context-specific. Someone with reactive traits may display behaviors that look like BPD in response to stress, but these traits are not necessarily pervasive, and they tend to resolve once the stressor is addressed or removed. Understanding the differences between these two can help in determining the appropriate diagnosis and treatment plan for individuals struggling with emotional instability or interpersonal difficulties.